Dun, dun, dun. Hello and welcome to Slice of Piefer. This is a new, improved Slice of Piefer with glasses.
Yeah, we have to talk about the elephant in the room, our eyes.
Your special eyes.
You have glasses on and I have a red eye.
Yes. Very true. Taylor's here. Wave to the fans. Wave to the fan.
Do it like they did in Disney.
Very nice. Mm-hmm. You got a special souvenir from Disney.
Pink eye.
Well done.
You know, it was something about looking over and seeing the 5-year-old licking the guardrail handles going, this isn't going to go well.
This is going to be tough. This is the happiest place on earth. And everyone keeps asking me, why am I winking at them?
This is also the same kid who likes to do the Ace Ventura talk out of his butt thing. So nice. I can't imagine how I got pink eye.
Yeah, also true. I heard that he thought it was quite funny, the story of farting on your pillow.
Yep, he told me that he did that after he got pink eye and then I got it.
Nice.
Now I don't have pink eye anymore. I just have the sequela, the remnant red eye, broken blood vessels that hopefully going to go away sometime soon. Poor patients, every time they see me are, what's going on with your eye?
Me too. Same difference.
Yeah, now you with your glasses.
Yes, I'm trying to look smarter.
It's working beautifully. You look so much smarter.
Yes. Well, I realized that I was having a little bit of difficulty seeing far away. Not much issue here up close, but far away vision was getting to be a challenge, which can be a real challenge when you're driving at night and the signs are looking a little blurry. So
you didn't see the
glasses.
signs, and now you opened up your eyes.
I saw the sign.
No one's going to drag you off.
That's right.
You didn't finish the lyrics. That's so sad.
I don't remember them.
To get into the life where you belong. Now, where do you belong?
Yes.
Face.
I saw the sign.
Good job. You knew that part.
You opened up my eyes.
There you go.
Yeah.
Now you're cooking.
Now
as the
we're
youth
there.
say.
As the Utes say. So
yeah.
So you're
All
back.
right.
You're back from Disney. We had a week of clinic without you. Lots of tears. So many tears here.
I don't
Patients
think so.
crying. Staff crying. I was crying.
I don't think so. I think y'all had a
What about
grand old time.
What about all those videos I sent of you of all my people crying?
You didn't send me any videos of people crying. It was like Sarah McLachlan commercials. In the arms of the angels.
Yes.
Look at this knee you could have injected today had you been here.
If you were just here.
Yeah. For your monthly support. You can help a helpless femur.
But you did take time out of your vacation to do an Instagram video. That was pretty cool.
Yep.
Very popular video, actually.
With the assistance of my husband, who lent me his phone and recorded
Thanks,
the video.
Dan.
Yep. He participated.
And your sunglasses to hide the pinkest of eyes.
Yep. There you go.
Yeah.
Yes, I had to do that. That's pretty rough. I didn't wear makeup the entire time we were in Disney just because it was so hot and you're sweating and I had a pink eye. So it's just like there's no point. And at one point, my stepson looks at me and goes, "You look pretty tired." I'm like, that's because I don't have makeup on. He's like, "Oh, that's it."
And also, don't ever tell a lady that she looks pretty tired.
He's a really sweet kid.
Yeah.
Yeah.
He was looking out for you.
He was.
I like it.
Yeah.
That's good. Well, we're off and running. Now we got to ask a bunch of questions. Mm-hmm. I'm ready. Leadership questions.
Yeah.
Talking about something fun.
This week, the rule that we're touching on is the cut rule.
Oh, yes.
What?
I know it well.
You tell me about it.
Well, what's the quote for the surgeons?
A chance to cut is a chance to cure.
Yes, people make fun of surgeons because of that, because they feel like you're always super cut happy. But that's not what we're talking about really here. Ultimately, it's you got to start, right? The cut rule is you can't fix something if you don't initiate and you don't get started. Yeah. So,
which in a surgeon's hand is cutting, right? For other people, it's making decisions like internal medicine doctors, people like that. It's going to be making decisions about treatment, starting something, doing something, right? And in leadership and business, it's going to apply differently. But in our profession, since we are in surgery, it's a lot of times refers to surgery.
But as a leader, essentially, you have to start and you have to act. And if you get analysis paralysis, if you fail to act, then all of the steps that happen after that, if you don't start, never happen, and you're still stuck. Yeah. you can't cure somebody
So
if you don't start.
sure. So tell me about a time when you were in the operating room and you had to make a quick decision based on incomplete information. So you didn't have, something comes up and you don't have all the facts. Tell me about a time that that's happened to you.
All right. So it's been years ago now, but and I think this happens sometimes with trauma. It happens with trauma. It can happen in elective cases as well. But the one that comes to mind to me was a lady from several years ago who we were planning to do a total knee arthroplasty, so a knee replacement surgery. And we made an incision, opened up the knee, and then what usually is like some kind of clear, straw-colored, yellowish, yellowish fluid that's just normal synovial joint fluid was really cloudy and really looked meh. And so now all of a sudden you're planning to go in and cut bone and press fit or cement metal and plastic inside of someone's knee. And if you do that in the face of infection, then that can be a challenge. Now, the thing about this particular time that I'm remembering is that the fluid was not normal, but it wasn't just like, obviously an infection. And so, and the rest of the knee didn't look, the rest of the knee had bad arthritis, but it didn't look terrible. And so we kind of, you were there. So we go through and we walk through that process. And instead of stepping through and, hey, we've cut, we've opened, the knee is ready. We see this and we stop. We sent off cultures. We took specimens. We sent them to pathology, all of which is happening while the patient is asleep. Because as soon as we cut that bone, we can't take that cut back, right? And so, once you've made that cut, you've got to replace the knee, or you've got to put in an antibiotic spacer, and both of those are difficult in that scenario. And so, if I had been a betting man at the time, I would have bet that it wasn't actually infected.
Right.
I was thinking this looks still too good. The patient was too happy. Their white blood cell count beforehand was fine. It was outpatient. She came in and joked beforehand. And so people who have even an indolent long-term infection in their knee just don't act like that typically.
They're pretty miserable. We typically meet them from call, right?
Correct.
We don't see them here in the outpatient clinic. We don't do scheduled surgery on them. We're seeing them because they've come into the ER. They're hurting so bad.
Right. And I think this particular patient, if I remember correctly, she had some immune compromise. She had rheumatoid arthritis. She was taking other medications. So there were a lot of different things that we could have issues with.
Sure. And after the fact, right, after talking to family, which we didn't have the knowledge at the time, but she did say that she had been feeling worse over the last 3 weeks.
Right.
And hadn't been getting out as much anymore. And then, so that was part of the history we didn't get leading up.
Right.
We just go in, talk with them like we normally do. She was ready to have her knee replaced, you know.
And so anyway, we're sitting in the middle of surgery, patient open. We just started washing it like it could have been an infection. Said, we will just wait before we make this cut. Said as soon as pathology calls, we'll be good to go to replace the knee. Pathology calls and says it's infected. So a lot of white blood cells, a lot of acute inflammatory infectious cells there. But I remember he said, this is infection.
Right.
And so at that point now you're kind
basically
of
it is until you prove it's not. Right.
Correct. And so that changes the entire process. And for a person who went to sleep thinking that they were going to wake up with a new knee, now she's going to wake up and go home the same day. She woke up with a drain in her knee and possibly more surgeries in the future, delaying the knee replacement for, I think we delayed it for 6 or 9 months. Even
Hers
maybe
was 6 months.
Yeah, 6 months. And so now all of a sudden you've made this big dramatic change. And so then you got to deal with that with family afterwards. And I mean, the key is you've got to be honest. You've got to tell people what's going on. And I think ultimately, live to the standard of what would I do if this was my mom or my sister? Because probably for us, the amount of time we took waiting for the pathologist and washing out the knee, maybe it was between 10 and 15 minutes, but we would have been probably close to halfway done with the surgery at that point.
Right.
And beyond the point of no return. So I think making that decision in the moment with not clear information or not absolutely precise information still allowed for us to get the best outcome, ultimately got her cleared of infection. I think her cultures ended up coming up positive as well. And then we came back later and did did the surgery once she had cleared infection, didn't have any issues.
Yeah, and in that situation, ended up being urosepsis. She'd had a UTI that she had been. And so she ended up getting more treatments and more things to cure that. Gotten in touch with some other specialists, and then had a happy, successful total knee arthroplasty 6 months later, and has done her annual follow-ups and been doing well. But it was just one of those, again, with the incomplete. It's one thing if you cut into it and it's just purulent pus just coming out. It's easy to make the call then because
I agree.
With all that experience behind, pus is easy to identify even to a layperson. But that kind of brackish, murky-looking fluid that you're like, oh.
Is this gout? Is this rheumatoid arthritis? Is this something else going on in here? What is this? Very tough.
Sure.
But I agree. Yeah, I think that's probably the most one that comes to mind, the easiest especially from an elective surgery procedure standpoint.
Yeah. So the whole chance to cut is a chance to cure thing. How would that phrase or this rule, if we're calling it a rule, the cut rule, for example.
Yes. You got to start.
How does that apply outside of the operating room? How would a leader apply that rule to their practice, to their life?
Well, obviously you've trained, you've studied, you've worked up to this moment, but if you allow yourself to become paralyzed, if you stop to either gather more data, to over-evaluate things, like eventually you have to make a cut and then you have to make decisions along the way. But if you don't start, you'll never get finished. And if you don't start, you'll never get to reap the benefits. So I think outside of you cut, you respond, you react, you move forward, and that is it's an action basically, and you've got to take action ultimately.
Yeah. Well, and not only does it cost you, it costs your team, costs everyone around you, right? The opportunity, for sure. All right. Is there a point in surgery where you stop looking at imaging and diagnostics and just rely on your gut and instinct?
So I think there are certainly we use things. So we use not only the patient's orientation, but the patient's our knowledge of anatomy. We understand where things are, and we push forward from that standpoint. I think that the most likely spot where I've seen that has been with robotic surgery. And so robotic surgery from an orthopedic side has really advanced, and it helps to make precision cuts. It helps with precision alignment. But the temptation, I think for many surgeons, and it was for me in the beginning as well, is to chase the numbers. Like I got to make the numbers look perfect. I got to have 0 degrees here and 120 degrees here, and I need to have the perfect amount of valgus and varus so that I get things where they need to be. And some of that, I think, in my mind, we found spots where it says like, you look and you say, well, this is clearly the leg looks long and on a hip, and clearly the leg looks long. Why is it telling me, why are the numbers okay? And I think you get in trouble when you chase that data. You keep chasing the data that says, okay, it's fine. Or you look and you realize like, okay, well, this person, in order to be able to get their knee fully extended, really needs to have 3 or 4 degrees of hyperextension, so that clinically they're going to be able to lock out their knee. And if you put them at 0, then when you see them in clinic and you look and you're like, oh, that person's flexed 10 degrees, and they're struggling to get that extension. And so for me, I think from a robotic surgery standpoint, that is one of those spots where you keep getting more data, but you realize that the experience of what you need, if you chase the numbers, then the outcome may not be quite as optimal as you'd like. And I think the best surgeons who are using the robot now rely heavily on their experience, and they don't let the robot dictate what they're going to do.
Can you recall when those two come together, when you realize like, I can't just chase numbers, I have to rely on my instinct and my gut as well? Is that like a pivotal moment, or is that something that came on gradually for you? Like, I think
it came on. I think when you're like, hey, all of the data says that this leg is perfectly straight, and I can look at it, and Taylor can look at it and see that the leg is bent 5 degrees, and you say, this just isn't what we need. And so then we've got to go and make the numbers look worse so that the patient looks better. And so you're hyperextended 5 degrees or 6 degrees or something. And so I think that there are those moments where we were.
Yeah.
I think early on with the robot for me, I was very tempted to chase those numbers, and I think that I had some early folks who were tighter than I wanted them when they came in.
But the thing I'll remember about with the first time I did a robotic knee with you and the first time I did a robotic hip with you is, yes, you had the same temptation everyone does to chase the numbers, but you ultimately didn't end there.
Right.
Right? Like, I remember when we were going to do the hip, and you're like, it's saying this, but I'm outside of the joint.
Right.
So this can't, like, and it was like, I could see in that moment where it clicked for you, like, yeah, this machine is helpful, and it made us make some really good strides toward certain things like inverting the cup better, like how far over you had to go across the table to make that happen and to get the right angles. But like it's saying we're well seated, and I don't even have it like
and
like I'm still on the soft
reamer's
tissues.
Not inside the body. Right.
Yeah, so I think it was that one, and that was the first hip I remember us doing, and I can remember the OR, I can remember everything because I remember thinking like, that's why it's surgeon operated, and that's why we don't have to be worried about any time in the near future where the robots are doing things by themselves because they can't. It needs both.
Right.
You need that as a guide, but that experience, and the same thing with the knee. They're like, yep, it's 0 degrees. And we're like, that's 5 degrees off there. Like, they're not going to be able to lock their knee out.
Right.
And we know that patients who can't lock their knee out struggle, right? They get quad overuse. They end up with falls. They end up with give way. They end up with a limp, all that. So I remember that case, us ending going, well, it says 3 degrees of hyperextension. And that patient did great. Like, clinically, very happy. Like, no problems.
Yeah, and some of the most respected surgeons that I've talked to, that's kind of what they say. We use the robot. It helps us with some precision. It helps us with that. But ultimately, at the end of the day, I'm looking at the knee and I'm making the adjustments that I need to make, and the robot doesn't dictate. And I think for surgeons who are learning and who are training, the robot can be super helpful for you to figure out those things and understanding, how do I balance? How do I antivert appropriately? How do I get the leg lengths where they need to be? But if you chase the numbers, then don't be surprised if you have patients whose numbers are perfect, but their function is not.
Yeah. So, and like you're saying with the robot, like the data tells you what's happening, but experience tells you what to do with it.
Absolutely.
Right. And so using that as a tool, but not the only, that's important.
I agree.
What's the mental sequence you run through when multiple things need your attention at the same time? In this situation, it would be in the operating room, but tell me about the process that you go through when you're in that situation where multiple things need your attention simultaneously and it's time sensitive.
So in the OR, it's all about orientation, right? And we've talked about this. Look at your hands. That's probably a rule we're going to talk about one of these days on here too. But basically, stopping for momentarily. You're not taking a 10-minute break, but you're stopping for a moment. Take a breath, a simple, easy breath. Back up, reorient yourself, prioritize what needs to be prioritized, and then move forward. Mm-hmm. I think that, and that's where looking at your hands helps, because as things start to feel like they're becoming out of control, when you can reorient yourself, now you can move forward without fear, without concern, without confusion and stress. Now, all the time, I mean, in your home, in your business, in the operating room, we're dealing with multiple simultaneous things at the same time all the time. And people get overwhelmed and you get stressed. And ultimately, if you can stop and take a deep breath before you blow your top at your kids or your coworker or whatever it may be, mm-hmm. then that makes a huge difference, because it just helps you to regain perspective in the moment of what's happening. And so I think for me, stopping, taking a breath, looking at my hands, that's what I do.
Yeah. And so it sounds like that, I mean, that system that you've kind of developed where you take a breath, take a moment, reorient yourself, look at your hands, and then go through the prioritization of what needs to be done when, and then delegation, right?
Oh yeah. You've got team members there. You're not by yourself. Right. And that piece
you try to do everything at once. That's when you end up with problems, right? Especially when there are qualified people who are there to help, right?
Absolutely.
That's like you sending your own faxes here at the office. Like, wow, on earth would you do that? Like, there's so many other people who can do that for you. Why,
right.
Why are you building the desks?
Right. Delegate and delegate. I agree. I think trusting your team, right? But if you let the stress in the moment overcome you, and because what usually happens is either people become almost silent, right? And if you become silent, then now everybody's confused, like what's happening.
Right.
Or the flip side of that is people just explode, right? And now all of a sudden, when you explode, when you lose control in the OR, everyone steps back. Everyone is like,
Right.
like if I'm yelling at somebody, which doesn't happen really, but if the surgeon is yelling at someone, right? If you yell at someone to not move their hand, then they're going to keep their hand steady the entire time, and they won't move it, even if they could move it to show you something better, and they know they could move it to show you something better. If you've yelled at them not to move, then they're not going to move.
Right.
And I've been the resident in that situation, right? I've been the person in training who was like, put this here and don't move, and you're like, okay, and now I will do that and stand here like a statue until you tell me what what breath I need to take next, and that part is. Right, that's now you've instilled an environment of fear where people can't function, and now not only have you increased your stress, now you have to tell everybody every exact move, right?
Yeah.
Like if you scream at somebody about giving you the wrong instrument,
right,
then don't be surprised when they have no instrument the next time.
Right.
Because they're going to make you tell them and point to the instrument that you want, and that's going to slow the case down. It's not what's best for you, not what's best for the team, and not what's best for the patient.
Yeah. Well, and I mean, that calm, that help. I mean, I've never seen you yell at somebody, not once in the time that I've ever worked with you, for you, never seen it. But there are also sometimes people can, again, just the way that they talk to people comes across that way. Don't worry, if you screw this up, it's no big deal. The person's just going to bleed out. And I was just like, I managed to do what I needed to do, but also then him going, hey, we need to cool the room. The PA's cooking right now.
Right.
Like, because I was just pouring sweat. And I mean, the biggest thing is I feel like that practice that you're talking about, or that system that you have, I don't think that that's something innately everyone's born with. I think most people aren't. I think it's a practice. I think it's setting up systems that work for you, so that you don't find yourself volatile or explosive in stressful situations, so that you can garner the kind of support and help from your team that you want, right? You catch more, flies with honey than you do with vinegar.
Right. Absolutely.
And so more people are going to try to help you. I mean, yesterday when I was walking in the hallway, I heard somebody, there was a student in the room with us, a student scrub tech, and somebody had asked them whose room they were just in, and they told him, and they're like, oh, that's the best room to be in. Like, he's so good. Like, he does a good job of explaining. He's so calm, and so those people all want to come in. They want to learn with you. They want to hang out with you because your room is the room to be in.
Right.
And I'm not saying that to make you feel good. I'm just telling you that's...
You're trying to make me feel good since I now have to wear glasses.
I think that they look good on you.
Yes.
You walked in this morning with a newspaper in your hand and glasses on. You look like Superman.
I needed a little hat.
You're like Clark Kent.
Nice.
Yeah.
I mean, my feeling about that is also patience. I mean, for team members, if you maintain an even keel, then in the moment that you change your tone, if you change your tone and become stressed, if you change your tone and become quieter, right? Everyone in the room now responds, right? So you set and establish the standard and an environment where everybody knows when things are going poorly. If you lose your top all the time, then nobody's going to know whether he's just
the boy crying
upset.
wolf,
right? He's just a guy he's just a surgeon who's yelling at me again, versus like, hey, this is really emergent.
This is just another Tuesday,
right? Right? Like if somebody tells you, hey, turn the music off, or whatever it is,
right?
Or if I was, I don't think I've had to do this ever with you, but if I was like, Taylor, I need you to focus, you would be like, whoa,
right?
something bad is happening right now.
Absolutely.
Because he doesn't say those things. And so I think that, not to give you an excuse in those moments, but like if you were there, if you did have your stress level going up, even if I started to yell at somebody, everybody in the room would, in my mind, would stop and be like, wait a second, this is something bad is really happening here, and we need to figure this out. And it wouldn't necessarily be like, oh, he's just a gigantic jerk.
But the thing is I think, again, with your leadership in the operating room, you don't have to do that. I've never seen you had to yell, and people take what you say seriously. They see your tone. They see the way that, we have a good time in the operating room. We talk, we listen to music, we have a good time, and we enjoy our cases. But we are always engaged with what we're doing, right?
Right.
We're always paying attention to what's going on the field. And so that's probably why you've never had to tell me, Taylor, I need you to pay attention.
Right.
Because if something starts bleeding, I'm there with a hematologist. Like that's what we do. Is we're focused on why, that we're privileged, we're blessed to get to do what we do.
I agree.
There's a lot better ways to make less stress ways to make money than what we do. We do it
Right.
because we're passionate about it.
I agree with that.
So
Amen to that.
amen, brother. Didn't I quote Hulk Hogan yesterday?
I like it.
Didn't I? I feel like I did. Maybe it was Scott Walsh. He was previously on this podcast.
Previously on the podcast.
Yeah.
We needed Scott Walsh to come on and tear the Hulk Hogan shirt off.
Yeah. Yeah, because Axel was asking a bunch about diabetes. And so we were talking about it.
Nice.
Yeah. Axel was like,
I do love that.
Yeah.
To be 5, it's just crazy, right?
Yeah.
He believes that diabetes is made up.
Yeah, he thought it was a made up word, diabetes. And now he's like, tell me more about this diabetes.
Right.
He's curious. I think too, all the signs on the rides at Disney, he was like, what's hypertension?
Oh, wow.
Yeah. And he said it right. I was like, it's another word for high blood pressure. He's like, what does that mean? So I tried to, again, how do you explain to a 5-year-old?
This is the vacation is
while we're going through these lines.
We're learning new words.
Yes.
I like it.
He's like, what are expectant mothers? Like, that means a mom with a baby in her belly. Why can't they ride the rides? Like, it may hurt the baby. Well, if it's going to hurt the baby, why is it not going to hurt me? Why do I have to go on this ride? Right? Like, that's the logic.
You're not a baby.
Yeah. But it was funny. We went on like Space Mountain. He's like, I'm not doing it. He shoves his arms and he's like crouched down, and Dan just picks him up, puts him in the seat. And then afterwards, he's like, that was pretty cool. That was pretty awesome. I'll do that again.
Yeah.
And then the next time we're doing it, I'm not doing it. He does it again. And the people are like, you seriously going to force this kid on this ride? And
it's like, yes,
yes,
we are.
because he actually loves it. He just gets a little stage fright.
He's just struggling.
Yeah.
Well, that wraps us for now, huh? The cut rule.
Yeah. Fun times.
What do you think? You got to act. You got to move forward.
Sure. I think that the biggest thing that the cut rule does, and again, I know it's like a trope and people don't like hearing it because it makes them think that every surgeon's just out to get them.
You're cut happy, right?
Right.
We got to get you into the OR if we're going to make you better, which is not true. We can do a lot of things without surgery.
Absolutely. But I think the way that principle applies is just, hey, you have to start.
Right.
Right. If you don't start, if you just stand there, timeout's done, patient's draped and ready. I'm sorry, I'm tongue-tied right now. I think the little bit of congestion I'm having up here is getting me.
If you just fold your arms and say, I'm not doing it.
Right. You'll never get on the ride.
The ride's never going to happen.
And you won't think about how cool it was afterwards.
That's right.
And you won't see the pictures of you looking
Axel.
awesome on the roller coaster.
Thanks, Axel.
Yeah.
Well, that wraps us for this week. Thanks, Tay-Tay.
You're welcome.
For being here. We're glad to have you back. Everybody's been missing you on the podcast. People just send me messages. Where's Taylor? Why did you yell at her on Instagram?
That was a pretty good one.
In Will Ferrell's voice.
Yeah. Felicity wasn't happy at you yelling at me.
Really? She didn't like it?
No.
That's funny.
Yeah. I told her it was a joke, that it was silly. She's like, that Dr. Monkey.
Perfect.
Yeah.
There you go. Let's see how this is. That's especially great with the
red eye.
pink eye.
Dan says I look cross-eyed.